Hello, my name is Toby and welcome to the first vlog of 2024. Happy New Year. I think last week we managed to say Happy New Year in a range of languages, but thank you for coming back for this video message. If you've been working over the festive period, you've been working over the New Year period, thank you so much for your service. Away from family, away from household, we're grateful. And if you are getting some rest now, even better. If you had a chance to rest over the festive season, well, that's what annual leave is for. And as we get towards the end of the public sector year, I'd really encourage you to make sure you are taking your rest, you are creating that space for your health and well-being for your annual leave. We're at that part of the NHS year where everybody talks about something called winter pressures, which is, some of you know, is not a language that I'm particularly fond of, because I think it has the potential to be somewhat disrespectful to the human beings in our community whose needs are completely predictable as the nights draw in and things get colder. That's why we fought so hard to get all that flu vaccination done and all that COVID work in place, and vaccination continues. Now, I wanted to give a particular thank you to two groups of people. First of all, everybody who is working to support services whilst our junior doctor colleagues are on strike. Appreciating their sacrifice in taking the strike, but also that of colleagues in covering for patients in our organisation to keep people safe. And then a particular shout out perhaps to folk working in the physical health care group, particularly the adult one across Doncaster and now Rotherham too, because in working to join up services for patients between general practice, hospitals and ourselves, there is a really important case finding and searching function to make sure that we're bespoking services and really getting to people in a personal way and as quickly as we possibly can, whether that's facilitating discharges at 10 o'clock in the morning or people who are putting in extra services in the DRA ED on the weekend. No sense of, well, winter happens every year can diminish our gratitude for the work that you're doing under considerable stress. And that's why the big theme of this message is really about health and well-being. The organisation, if you look back over staff surveys and so on over the years, has a really fine reputation, in your opinion, your feedback, for the work we do on health and well-being. It's really important with all the plans and the promises and the strategies and the stuff that doesn't get lost and in fact is grown and sustained. That's why we're working to make sure we can get gym access across all of our sites. That's why we're focusing, for example, on the healthy eating offer that we've got in our organisation. I had the most wonderful meeting this week with our catering team who've done work over the last 6 months on our patient-facing food, try and make sure it's suitable for people's different religious observance, it's nutritional, and it supports people perhaps with neurodivergent needs, both in food choice and food presentation. Really excited by the work that Lisa and the team have done to put those arrangements in place, and I think we'll be hearing much more about that as we go towards the spring. But also important to make sure that we've got a 24/7 food offer across our sites, and that food offer positively promotes healthy options at a time when lots of people are doing different versions of a different January. It's probably appropriate to emphasise that we really want to be making sure that we're creating the healthiest options for people, busy people working shifts and colleagues working across all of our sites. So something to look out for, I guess, as we go forward. Perhaps to end with a plea that you really do get your PDR and your appraisal in and booked. It's a key part of how any organisation, including this organisation, takes a view on how things are going. And you know, health and well-being is a part of that conversation too. It's not just a discussion about objectives or a discussion about training, but it's also a conversation about you at work, how you are, whether we're finding work-life balance, whether there are more things the organisation could do to support your health and well-being. So for all the right reasons, I really hope that you look forward to your appraisal, to your PDR, and even as I speak, you're getting ready to make sure you've got yours booked in. Really big part of how this organisation supports people, supports staff, supports teams. Big part of Ardash, so play your part in getting that in place. Lots to look forward to in the year ahead. I'll leave it there. See you next week. Thank you.